Hey everyone, today I'm going to be talking to you about Lyme disease. Lyme disease is a kind of a lifelong disease that, people that get it suffer with it on a day-to-day basis pretty much for their whole rest of their lives. And it is caused by a tick bite, and this tick has been infected with the bacteria borreliosis. And this bacteria, it looks like a spiral type. It's a spirochete, and I have a picture of it for you right there. That's this bacteria, and it infects the tick. And then when the tick bites you, and you don't realize that you've been bit by a tick, that's when it gets transferred into your blood system. And symptoms usually start to appear within 3 to 30 days. So the first sign of Lyme disease is you get this rash. It's called the bullseye rash. So it's really easy to spot. Sometimes it's hard to, see if you have a tick on you. If you've been outside, it's really good to check for that. So once you've noticed that you have this kind of rash, or you think you've been bit by a tick, you should definitely go see your primary care doctor as soon as possible, because Lyme disease isn't this kind of disease. Okay? It's not a sick Lyme. It is like really serious. So, and I know from personal experience, when I was little, about 2 or 3, I got bit by a tick right here, and had to be on antibiotics for just about a month, just to make sure that they caught the Lyme disease early and I wouldn't have any later repercussions, because as I'll explain later in the video, you're gonna have lifelong ailments from this disease. So the first symptom we just said was the bullseye rash. It can also cause Bell's palsy, which is where your face droops, and you have almost like you've had a stroke, like you just have no function, no feeling, but it's only temporary. You also get flu-like symptoms, fevers, fatigue, nausea, sweating, chills, things like that, joint pain, muscle pains, and worst case scenario, it can travel to anywhere in your organs and in your body, your brain, your heart, your lungs, whatever. But worst case is Lyme carditis, which is where the disease infects your heart and can cause palpitations, heart attacks, sudden cardiac death. So that's pretty serious. Also, just good to know, it's not contagious unless the person that has been infected with the disease is pregnant. It can travel to the fetus. So just a heads up, if you're pregnant, you go outside, take the proper precautions, which we'll get into here in a little bit. So symptoms can show up anywhere between a few days of a bite to a few weeks after. Those are the short-term symptoms. If you get into the doctor early enough and get treated with the right course of antibiotics for the right amount of time, you're usually okay with some mild side effects, throughout your life. But if you wait too long, or you don't get the proper dose of antibiotics, you can have long-term or chronic Lyme disease. The thing about Lyme disease is it's really difficult to diagnose because it mimics so many other diseases with all pretty much, similar symptoms. Fever, headache, nausea, all that kind of stuff can, go to so many different diseases. So long-term, you fatigue, depression, trouble sleeping, memory loss, heart issues, heart palpitations, enlarged heart, congestive heart failure. So, and the thing about it is, Lyme disease can hide. So if you don't get it properly treated, the bacteria that causes Lyme disease can actually hide in your body, and years and years and years later can actually reappear and, infect you again, so your symptoms start back up. So it's really, really hard to treat when it gets to this point. Also, a good thing to do is to, with prevention, animals can get Lyme disease also. That's why you always see the flea and tick commercials. So you want to make sure that your dog or your cat or whatever animals you have are properly treated with flea and tick preventative medicine. You want to check for fleas and ticks regularly on your animal. If you find one, you should remove it immediately with tweezers. Make sure that you pull the tick out of the animal's skin by the head, because if you leave that head in, the tick is still injecting the bacteria into the animal or yourself into y'all's bloodstream. So preventative is really, really big with Lyme disease. the best ways to prevent Lyme disease is to avoid high grasses or woody areas. Wear the proper clothing, high socks, high shoes, long pants, long sleeves, hats, hair up, and you should wear light colors, you know, pastels, whites, anything like that, because that makes it easier to be able to see the tick on your clothes or on your skin. And then once you get into the house, take your clothes off immediately, throw them in the dryer for about 10 minutes, and this helps kill any ticks that happen to be on your clothing, and then take a shower immediately and wash your clothes. Same with your animal. Bring them in, inspect them for ticks. There's a little diagram right there that shows you, you know, look like a typical outdoorsman. So that is the information on Lyme disease in a very short video. So feel free to Google or research some more, because there's lots and lots and lots of information out there. Lyme disease is a serious illness that does affect millions and millions of people all over the world. There's a Lyme disease awareness program. So thank you.